Hey, what's up everybody? This is my sister Kari.
Hi, how are you? This is my sister Risa.
Today we're actually going to talk about something really personal, and that's hospice. Nobody wants to talk about it, but it's super important, and it's something that most of us actually will experience. And to be perfectly honest, we are actually going through it right now with our mom, so we figured that we would actually share what we're learning with you. Seriously?
That's not me.
That's not me.
Hospice is a scary word. People think that it's, oh, you must be really, really terminally ill, in dire pain, to be on hospice. But that's not true. Hospice is really a system of support, not just for the patient, but for the entire family involved.
And I think that's really important actually, because it is for the family as much as it is for the patient.
Yes, and it also is maintaining a quality of life for the patient and also for the family members. The quality of care. Also, it's an efficient way of maintaining pain management. And there are 24/7 call with a live person, and it's not like trying to get in touch with your physician on a Sunday afternoon, which is nearly impossible. You can always get in touch with a professional NP or RN or a physician on call.
I think we actually have to go back though.
questions.
We have to go back and to define actually what hospice is. So hospice is a diagnosis. Well, I guess it's a notice that the patient, whoever, has terminal illness and has a life expectancy of 6 months or less. And that is determined by the doctor.
But it's not always 6 months or less. Some
Right.
people will.
But that's the
continue-
actual official definition.
Right. But some people can last, years on hospice.
Right. So that's kind of I guess one of the myths, that you can go on a hospice and then you could actually get off hospice if you
Getting
if you
better,
get
if you
if you
improve.
get better.
Yeah.
So, in our case, it took us a really long time to decide whether or not to go on hospice, because we felt like she wasn't there yet. And, it's emotionally, it's a really, really hard decision to make, because, there is an ending to it. So, and we want to make sure that our mom is as comfortable as possible and that she still has a life that's fulfilling and full of joy and love and all that kind of stuff. So, but of course, there's a lot of things, there's a lot of bureaucracy and a lot of paperwork that go into hospice that we feel like is really super important, so that you guys can be prepared when the time comes for you. So first step is that we had a doctor's appointment.
Yeah. You start with the dialogue with the physician. We've been very fortunate to have physicians that are really caring and really want to maintain our mom's quality of life. So we've had that conversation with them, and a few of them did say, I think, guys, it's time to get hospice into the home.
And for us, we agreed that it was about her quality of life.
Yes.
It wasn't really about duration. It's not really about quantity and the number of years. It's making sure that the years that we have together, and for her especially, is the best quality that can be.
So my concern was keeping our mother pain-free and comfortable and safe. So that's paramount. And that's why I agreed to this program.
So we got the notice, we got the referral, and then you have to choose a hospice. So we chose a hospice. We chose Northwell Health. We're out on Long Island. And so you get this, a nurse comes, you make an appointment, you make the call and you talk to them over the phone, and then once you choose, the nurse comes over and does an assessment.
Yes, does an assessment, takes all the info down. All her medications were taken down, and her diagnoses. She has several. So basically she is being treated for Parkinson's disease. She also has...
she had a stroke 19 years ago.
Yes.
So she has right side paresis.
But she also, we discovered, has a enlarging tumor in her uterus, which is not operable. So this is where the hospice comes in to help with the pain and also the progression of the Parkinson's. They take a bunch of information, critical information, and also ask questions about, I guess, family dynamics, you know, and who is here to help out, who's not here, if there are aides in the house. We are also part of the CDPAP program, which we have aides that come into the house.
CDPAP is a Medicaid
program.
So we have a rotation of aides that come in. So we get this packet of information, you know, you get stuff like this, which is, I guess,
the symptoms when one becomes near death.
You can also have, so we're having hospice at home, but you can actually also have hospice in a facility where the person goes into kind of like a nursing home type of situation, like a hospital. But my mom has requested that she pass away at home, and so that's something that we want to honor. Thus, that's why we're doing hospice at home, and everything kind of comes to us, right? Mm-hmm. So, big thing, actually, I think that's pretty infamous, is the med kit, which has all sorts of different stuff in here that's supposed to be alleviate pain and.
Well, you have the morphine, you have anti-anxiety,
So this is the morphine, which looks weird to me, but
it's a pill that just melts on your tongue. You don't take any water with it, so it's easy for the patient.
And how strong is this?
This is the weakest, because mom is so frail and so light in weight.
Right.
They want to start off at the smallest dose and then increase as needed. But basically, this is like a comfort pack, they call it. It's got anti-anxiety.
Yes, anti-anxiety.
Stool softener.
Suppository.
Pain reliever. For nausea. And then also
what is this?
atropine, which is used to dry up secretions, and you know, sometimes people get a lot of secretions in the back of their throat. This kind of dries it up. And that's stool softener.
Yay.
Well, it's very important.
I know. Well, that's the big thing that people don't talk about, is the constipation, and like, because once the person is bedridden, everything really starts to slow down.
Correct.
So that includes
it's
balance.
the little things in life, you know, that really count. Right?
So we also got a hospital bed.
We were delivered a hospital bed, which is adjustable in height, which is great because our aides, we have very tall aides and very short aides, so it's very convenient to help them not get injured. Back injuries are common when you're transferring patients. But also they have given us an oxygen tank to relieve anxiety or ease pain if needed. We have that on the side. They will provide shower chairs, wheelchairs, things like that, hard, durable medical equipment.
And this is a big thing, is that it is a Medicare benefit. So Medicare actually takes care of all of this and pays for everything, which is huge.
Yes.
Because already, you know, families are under stress and trying to figure out how to provide as much comfort. So this is actually an amazing benefit.
We have access to social workers, RNs. We have a dietitian on board, physical therapist. It's just amazing. And they also have a chaplain, a whole network of people working together, and their goal is to just keep the patient as comfortable and safe and pain-free as possible. Quality of life, maintaining quality of life.
So as we kind of go through this process, so this is going to be a kind of a process for us emotionally and also just bureaucratically and kind of going through all the paperwork. So we'll kind of document as we're going through how we're doing, how mom is doing, and we'll share it with you.